Good morning, everyone. Please welcome on stage Dr. Ahmed Al-Dahri, Head of Department in Cleveland Hospital. حضرتك بقى ايه؟
السلام عليكم ورحمة الله وبركاته. Good morning, ladies and gentlemen. We'll start just with a short video. الصوت يا خالد. Okay. So my name is Ahmed Al-Dahri. I'm from Cleveland Clinic Abu Dhabi. I would like to start by thanking Dr. Mohammed Ahmed, the chair of the conference, for such a lovely event. I would like also to thank Lilly for organizing and sponsoring this presentation. So we'll talk today about ixekizumab TALS. So why should we start early and why should we be ahead of the disease? We know that psoriasis is not only a skin disease, it's a chronic, complex systemic condition. Around 2 to 4% of the patients worldwide are affected by psoriasis. It is characterized by the red, scaly, thick plaques, and it is caused by a complex interplay of genetics, environmental, and immune factors. This is associated with decreasing the quality of life of the patients, as well as increasing the morbidity, and it also causes a lot of comorbidities, which I'll be talking about in the next slide. It is very important to focus on the signs and symptoms the patient present to you because we tend to underestimate itchiness, skin pain, and sexual impairment. So always ask your patient about these signs and symptoms. The comorbidities that is seen with psoriasis are numerous. So we have metabolic syndrome, type 2 diabetes, dyslipidemia, etc. But the most important I would like to focus on today is psoriatic arthritis. 1/3 of the patients who suffer from plaque psoriasis will develop psoriatic arthritis within the course of the disease. The mean time to develop the psoriatic arthritis is 10 years. Talking about psoriatic arthritis, it runs through 3 phases. The first phase is a preclinical phase where there is an activation of the immune response involving the enthesial and the synovial tissues. But in this phase, there's no signs and symptoms at all. And the second phase, it's also called the subclinical phase. Still, you have no signs and symptoms, but there is already evidence of articular inflammation, and it's only sensitive imaging investigation can detect it. The third stage is the prodromal phase, where there is the start of some signs and symptoms. The patient will have some non-specific joint pain, but still didn't develop the full picture of arthritis. It's very important for us to detect the patients earlier, preferably in the first 2 phases, to prevent psoriatic arthritis. In this German registry, they ask the patient, what do you need from the treatment? So 95% of the patient will ask for 2 things, to have a healing of all the skin lesions and also to have a quick response. That's why we talk today about ixekizumab TALS, because it gives us the quick and rapid response. So in this clinical trial, it shows that as soon as 2 weeks of initiating the treatment, so only after 1 dose of the medication, you can achieve a 56% PASI 75. And this improvement increases up to week 12, reaching almost 97%, and then it will get maintained over a period of 5 years. Looking at the other endpoints, PASI 90 and PASI 100. Even with PASI 100, which is a difficult endpoint, as soon as week 12, you can expect 40% of patients to achieve PASI 100, which can improve to around 66% over the period of 5 years. This slide is just showing the comparison between TALS, ixekizumab, and another IL-23, which is gosylcumab, Tremfya. So in the first 12 weeks, after just initiating the loading dose of ixekizumab, you can have 1.6 more patient achieving PASI 100 when you compare that to Tremfya. So looking at some special areas, for example, here we talk about scalp psoriasis. You can expect the same results as with skin psoriasis. With the first 12 weeks, 80% of the patient will achieve complete scalp clearance, and this will even improve over time, reaching up to 90% of the patient in 5 years period. Nail psoriasis. Nail psoriasis is a little bit slower, as we all know, takes a little bit more time, but still even after 12 weeks of the treatment, 18% of the patient will reach an APC0, which is complete clearance of the nail disease. This improves to 70% over the first 60 weeks and then up to 80% over a period of 5 years. This slide just to compare again with Tremfya. After 6 months of treatment, you can see that with TALS, you can achieve 63% PGAF of 0 compared to 44% with Tremfya. Now, let's move to real-world evidence. You know that clinical trials are very homogeneous group of population. It doesn't reflect the real-world practice in your clinic. So real-world evidence give us a better reflection of what we really should expect in the clinic. So they have this PSOHO study. It involved around 2,000 patients from 23 countries, and 11 biologics were compared. The first thing we are looking at here is the complete skin clearance, which is PASI 100 at week 12. With TALS achieved the best response. Almost 40% of the patient achieved PASI 100 within the first 12 weeks of the medication, except for brodalumab, which is not available in our region. Looking to different subgroups, you know, if patients, some patient comes with you with very high BMI, for example, or the higher disease duration. So regardless of the subgroup of the patient, you should expect the same results when using ixekizumab. Here we are looking at treatment PASI 100 after 6 months of the treatment. So with TALS, 50% of the patient will achieve PASI 100 at 6 months, which is better than the rest of the biologics. PASI 90 also, again, at 12 months, achieved by 40% of the patient, which also showed superiority compared to the rest of the biologics. Now, another concept is durable complete skin clearance. What do we mean by durable? So, patient who achieved PASI 100 at week 12, and then again at month 6 and at 1 year. So he needs to achieve all the endpoint in the three areas. So TALS achieved almost 22% durable complete skin clearance, which was also better than the rest of the competitors. Scalp psoriasis, 7 out of 10. You can see also better than the rest of the medication. This was at week 12. Nail psoriasis at week 12 also better than the competitor, but I mean, you can argue that 12 weeks is very short for nail psoriasis. Let's have a look at this slide. It shows also the greatest numerical improvement in moderate to severe nail psoriasis at month 12. So even after 12 months of the treatment, you can see the green dot here is the improvement shown with TALS, 39%. The only close by was Cosentyx, and then the IL-23 had a great gap between them. So this is just a patient who had moderate psoriasis. She failed topical treatment. She was given TALS after only 2 doses. She had complete clearance, and then there's only the post-inflammatory hyperpigmentations remaining. So my final slide, just to remind you about the FDA-approved indication for TALS. It's adult psoriasis, pediatric psoriasis, radiographic axial spondyloarthritis, and non-radiographic spondyloarthritis, and of course, psoriatic arthritis. Have a few minutes for questions. Please feel free to ask. Thank you. Thank you very much.